Hello, everyone. We'll give it a few minutes for everyone to join in. I think we can get started. Good afternoon, everyone. My name is Ketki, and I will be the facilitator for today's webinar, Navigating Health and Wellness. I'm the Cancer Programs Coordinator here at ACAF, and I reside in Minneapolis on the Dakota lands. Moving ahead, I would like to provide everyone with a few housekeeping items. This presentation will be recorded and uploaded to ACAF's YouTube channel. Please share your tribal affiliation and land acknowledgement in the chat box. A reminder to be sure that you've muted your microphone throughout the presentation. If you have any questions, please feel free to ask them in the chat box and we will try to answer them all at the end of the presentation. If you have any questions in the future, feel free to contact ACAF at the given email information. Moving ahead, I would also like to provide a little bit information about what ACAF is. ACAF is a national nonprofit established to address tremendous cancer inequities faced by American Indian and Alaska Natives. Its mission is to eliminate cancer burdens on American Indian families through education and improved access to prevention, early detection, treatment, and survivor support. Our vision is a world where cancer is no longer a leading cause of death for American Indian and Alaska Natives. Through hard work, culturally appropriate community-based programs, and policy change that affords Native people access to the best prevention and treatment strategies, we see a day where American Indian communities are free from the burdens of cancer. Now, I would like to introduce our guest speaker for today, Sylvia Rodriguez. Sylvia is a patient navigator for Texas Native Health in Dallas, Texas, and a certified community health worker. She is also a co-author on anthropology article. She is currently pursuing her master's degree in public health. So I welcome you, Sylvia, today at this webinar. And I'm honored to have you present on this topic. I pass it on to you, Sylvia.
Thank you. Thank you. Thank you for the introduction. And thank you for allowing me to come and speak today about the role of a patient navigator. So I want to talk a little bit about what a patient navigator is. Patient navigators help increase health equality within underserved and underinsured communities. And this is a big task. Patient navigators are also employed in local clinics and hospitals, and they can be seen helping patients navigate through the healthcare system. While they do that, though, one of the biggest things that they do is they build a strong relationship with the patient by providing them a safe place to discuss anything that they couldn't discuss with the patient, with the doctors, excuse me, and giving them more of a non-judgmental place to just speak and talk about what they want, what they need, to express what needs they have. Next slide, please. So some of the responsibilities of the patient navigators, they're the main point of contact for patients. So if the patient when the patient leaves their doctor's appointment and they have additional questions, they can always call and ask to speak to a patient navigator and help them to better understand what their appointment was just about, or if they had questions about their medications, the patient navigator is there to help them out. Also, we provide them the necessary education for them to maintain their appointments, to make sure that they know that they need to come in once a year for their screenings or get the immunizations that are needed, and just educate them through that, making sure that they know that that is very important. And also to make sure that they're getting their refills that they need. And that is also another thing, is also that the patient navigators work closely with the doctors and other programs that the clinic may have, and also to get them involved in other health programs. One of an example of a health program is a diabetes program, and that's what we have here at the clinic. Making sure that they adhere to their medication, the regimen. Also, we have a community garden where we can educate the patients on growing local fruits and vegetables, and also providing exercise for them. Next slide, please. One of the main things the patient navigators do is to remove barriers. This is, I believe, very important, as we help them to we help identify the barriers that they have, as far as, are they needing a place to a safe place to stay? Are they needing extra food? Are they needing help getting to their appointments, as far as travel assistance? And we also help them seek other healthcare services within the tribal systems. If they're not able to get what they need here through the clinic, then we can refer them out to the hospitals in Oklahoma. We also have, excuse me, I got lost. Okay, so next slide, please. So cancer screenings. Yes, this month is Cervical Cancer Awareness Month. And what we're doing is putting out there on Facebook to educate the patients on how important it is to get screened for not only cervical cancer, but for breast cancer. So what we'll do is make them appointments. They come in, they'll fill out paperwork for, if they're eligible, they'll fill out paperwork, excuse me, for the Screen Our Circle, which helps them to go further if they need to get a mammogram, or if they need further diagnostic screenings for mammograms. Then the results will come back, and depending on if it's negative or if there's a finding, we do call the patients and let them know that the findings are negative. But if they need additional screening, then we'll give them information on it and help them through that process. Next slide, please. So in conclusion, I did want to let everyone know that increasing health equity within the underserved communities is very important, and breaking down the barriers, promoting health and wellness, and providing education to the communities that they serve will help improve better access to healthcare. Thank you. Any questions?
Thank you, Sylvia, for providing with us that information on patient navigation. And I request everyone, if there are any questions that you all might have, you can put those in the chat box. And meanwhile, we're waiting for those questions. Sylvia, I also wanted to know a little bit about how important it is for a patient navigator to do an active follow-up and schedule timely screenings for the community members.
I'm sorry, what was the beginning of that question?
So how important it is for a patient navigator to do an active follow-up and schedule timely screenings for
Yes.
community members?
Yes, it's very important because it's very important for the patient to at least get the first screening so they have a baseline to go on for the next screening, and they can catch if anything unusual comes up. So yes, it's very, very important.
Yeah. And how often do you schedule these timely screenings for cervical cancer?
Well, we have several appointments on the schedule weekly. So weekly, patients are coming in for their PAPs. And then that's where they find out whether, it's normal or negative.
Right. And we have one more question. What do you find most fulfilling while you do your navigation work?
The most fulfilling thing for me as a patient navigator is helping the people who don't know, educating them on the importance of their health and what they have to do to maintain health.
Right. And during this entire process, while you're trying to navigate your patients, trying to help them with various resources, or getting them their due outreach, do you find patients being resistant to getting navigated? Is that one of the barriers that you faced?
It's not really a barrier, but I think it's more of they don't really know what a patient navigator is or what their role is. So I think that getting that message out will make them feel more at ease at coming to us for help.
Right. And again, during this process, how important it is for you to also include a family member of that client or that patient who is, going through any kind of diagnostic treatment or any kind of positive diagnosis, or if that person is recently diagnosed with a cancer diagnosis, with a positive cancer diagnosis. How do you really incorporate the person's family members in that journey?
So what we would do is ask if there are any family members that they would feel comfortable with being there with them through these steps, and then just stress how important it is to have the family support.
Okay, so are you like in constant contact with the family members throughout the journey, or do you schedule those one-on-one interactions with the family members? How does that work?
I haven't yet had to do that, but if I were to be in that situation, that's what I would do.
Yeah, and I think one of the questions that we have from Tabitha Chilton. She is wanting to know what is the most difficult barrier that you have had as a navigator.
The most difficult barrier is probably trying to stress to patients how important it is to stay up with their medication, because they will wait till the last minute to try and get refills. And they're like, oh, but I ran out 3 days ago. So we tell them, call us at least 2 weeks before you run out of medication so we can have this ready for you when it's time for a refill.
Right, right. And I know we did speak about screenings a bit, and then what kind of challenges you've really faced while, letting know your community that's important on a regular basis, on a timely manner to get yourself screened for cervical cancer or any kind of cancer and kind of medical condition.
So I found that getting our patients to come in for a mammogram screening has been a big barrier as well. They'll make the appointment, but then last minute they'll cancel or they won't show. And then like we'll have a outreach for mammograms and everyone's excited and they want to do it, but last minute they cancel. Or when I try to call patients and say, hey, it's time for your mammogram, and they'll be like, oh, well, I think I'm okay. I don't need it. And so it's hard to try and convince them that
Yeah.
you need to at least come in for one mammogram.
Yeah, right. And do you think stigma plays a role in getting screenings done? Uh, if a historical trauma or an ethical issue or a social stigma, does that play a role for a woman to come in and get the cervical cancer screenings done or a mammogram? Uh, have you
I
come up?
think I
Yeah,
think that yes, there is a stigma as far as, because it's very personal for a woman,
yeah.
um, to go and have somebody look at their body in a
Mhm.
very personal way. So I think that may be one of the stigmas for our female community.
Yeah, yeah, yeah. And we have one more question from Tabitha, and she wants to know, do you work with different Indian health services or local health organization for assistance in getting more screenings completed?
I work at a clinic for Native Americans, so I work for this clinic, and it serves all of the surrounding tribes that are federally recognized.
Right, right. And I do know that you're working with different kind of people, they have a different kind of experience, different journeys. And do you how do you assess barriers? So everyone faces different barriers. So is there something that you have that, you come up and you assess those barriers for your community?
So one of the ways that we know that our patients is going through a barrier is when they no-show a patient, when they no-show an appointment.
Mm-hmm.
So we'll call them back and say, well, I noticed you no-showed. Was there a reason for that? And they'll just say, they'll tell us their reasons. And so we try to take that barrier away by finding out what the barrier was and
Okay.
then make them another appointment, make sure they come in.
And they do come in when you make another appointment for them?
Yes.
Okay.
Yes.
That's good to know. That's
Yeah.
good. Yeah, yeah. And we have another question from Faith Sharp. And she's wanting to know that do you have any she had a success with training an elder women to advocate to the younger generation. Uh, do you have any success with this?
With advocating.
Yeah, advocating to the younger generation, motivating them to get screened in that way.
I'm sure there are some successes out there with dealing with that, but I personally haven't dealt with it.
Right, right. Yep. And I think those were the questions we had. I don't know if you have any last thoughts that you really want to share and motivate the community to go there and get screened.
Yes, definitely. If you need to speak to somebody, about the importance of screenings, find somebody, talk to somebody, and just realize that it is very important for your health and to get screened.
Okay. Okay. All right. Thank you, Sylvia, for
Thank
being a
you.
part of the webinar today. And thank you, everyone. Uh, oh, Sylvia, we just had a question coming up. It's from Rebecca, and she wants to know what are some cultural aspects you use to get patients to come to get screened. I think you're muted, Sylvia. Yeah.
So what we try to do is use our outreach information and show that it's important for women, period, to get screened. So we try to do it as showing, Native American women that it is important to get screened, that, it's the different ages that everybody needs to come in and get screened, from young to however, I think it's like 70 something or maybe 60 something. I'm not sure what the age is, but we try to use that as far as a cultural aspect and show that all women should come in and get screened.
Right, right. And do you think anytime a cultural aspect has become a barrier for any women to come there and get screened?
I don't know of any as of today.
Okay, okay.
I can let you know though.
Yes, okay. I think that's it from us. Thank you, Sylvia. Thank you, everyone, for being a part of this amazing webinar. Thank you.